Good morning, friends and colleagues. Pavel Krastev, DDS. I join you today from Dix Hills in New York. We're a little bit on the road because of the holidays. As usual, on behalf of Global Summits, myself and Dr. Kiano Shah, I'd like to welcome all of you today here. And I'd like to also take this opportunity to wish all of your friends and your families a happy Easter. For those of you that celebrate Easter, also happy Passover for my Jewish friends, and happy Ramadan to all of our Muslim brothers and sisters. I wish you guys just a wonderful day, wonderful holiday, or a wonderful season for these holidays, and may they bring joy and peace to you and your families. On that same note, I'd like to express our prayers for the people in Ukraine, for what's going on, and we're very saddened by the situation, and hopefully it'll resolve as soon as possible, and we'll move forward. Having said that, a couple of things on a personal note. Everything started from a lemon seed a few months back. I broke a tooth, and the tooth got to the point where I had incredible pain, and I was very fortunate to have a lot of good friends from a long time ago, from some new friends, and they all came to my rescue, and I'd like to mention them one by one and thank them. So initially, I called my friend, dear friend, Dr. Lyuba Borikonova, and she's an endodontist. We realized, she came to my office, we realized the tooth was cracked, needed to be extracted, and the pain was absolutely intolerable, to the point that I was going to take it on myself. Lo and behold, I contacted Dr. Kiwan Shin. Now, Dr. Kiwan Shin is an old mentor of mine, a dear friend of many, many, many years, and he's the one that actually started my implant career on fire. So I owe him a great deal, and fortunately, he came at 9-10 o'clock at night to my office and took the tooth out for me. Following that, I had some work done by Dr. Eric Bremer, who's a wonderful endodontist as well. And finally now, thanks to Boss Lady, my lovely wife, she convinced me that I should put veneers in my front teeth. So I will give you guys a smile. I'm in temps right now. Dr. Sharif Radwan. Now we're going to talk about him pretty extensively. Dr. Sharif Radwan has multiple practices. He's a absolutely fantastic surgeon and cosmetic dentist with 3 locations, I believe. So he's doing the actual makeover, and he placed my implant. And now, as of yesterday, as I said before, I am in temporary veneers in the front, and I'm loving the new look. But forgive the smile, I'm missing a premolar. So as dentists, I think we're very fortunate at times that we can look to our dear friends and colleagues to help us in these situations. And certainly all the names I mentioned, they're wonderful people and clinicians. And I'm really, I'm blessed. I'm so excited that I have such wonderful, caring people to treat my own mouth. So having said that, today, guys, we have a very interesting presentation with Dr. Ahmed Hamdy, who joins us from Cairo, Egypt. And the topic today will be custom. Initially, I thought it was custom abutments, but it's actually custom healing abutments and implant dentistry. So as most of you know, dentistry is extremely exciting. I am about on the cusp to hit 30 years in the industry. And there's certain things I absolutely adore doing. I mean, endo is always been a hobby to me. I think it's one of the most challenging things to do well in dentistry. Of course, implantology is another passion I have, but lately I'm on fire with ProTaper Gold, and I'm learning the system. I am practicing day and night and studying Dr. Cliff Rutto and John West's videos on YouTube. And, that's the whole point I'm trying to make, is we have such great information at our fingertips, especially for the younger colleagues. I mean, you guys can go on YouTube and learn how to do anything that you want to do, and get such accurate depiction and description of how systems function, how they operate, the do's and don'ts. And this is all wonderful. So this is my new hobby now. I'm getting back into endodontics heavily because I just enjoy it so much. So I'm very happy to introduce Dr. Ahmed Hamdy to you guys. But before I bring him to to the screen, I'd like to read his bio. Great guy. I actually met him today physically for the first time, not physically, virtually, I should say. But let me read his resume, and then we'll jump into a great presentation. Okay, so Dr. Ahmed Hamdy is a course director for several private courses in the field of periodontology and implantology. He graduated from dental school, Ain Shams University, located in Cairo, in 2021. He received his master's degree in oral medicine and periodontology in 2019. He awarded his certificate of appreciation for his active contribution as a speaker and course director in the second and third International Ain Shams Dental Conference of 2016 and 2018, respectively. Also, he received the EADS trophy for his active participation in EADS 2016 conference. Dr. Ahmed Hamdy is currently a lecturer teaching staff members on periodontology topics and implant dentistry in BUE. Dr. Ahmed Hamdy received All-on-4 Technique in Implant Dentistry certification by the J Dental Care Teaching Center in collaboration with the University of Modena, Italy, in 2017. Also, he participated as an international speaker in several international events in Iraq and Italy. Moreover, he is a certified dental photographer and received his certification from Birmingham, United Kingdom in 2021. He contributed to the literature with a research in the International Journal of Dentistry. Adhering to the advancements in the understanding of medicine, particularly in dentistry field, Dr. Hamdy is aspirant of an maybe it's a misprint, is ambitious to discover new dental treatments, technologies, techniques, to stay ahead and of other regular dentists and step out the common dental service in order to provide his dental patients with spectacular dental treatments and provide his students with enlightenment and inspiration to form an endless flow of services and knowledge transfer to elevate the dental industry in the MENA region. Dr. Hamdy, that's a pretty hefty duty not interview. My God, I'm celebrating too much today. A very nice bio. I look forward to your presentation, and I love the fact that you're involved in teaching and sharing knowledge, because there's no reward as great as when one teaches and shares knowledge with their colleagues who appreciate it. I mean, some don't care, but so pleasure to have you, my brother. I turn the stage over to you. I'd love for you to say a couple of words to our audience and just tell us about yourself, about your life a little bit, anything that you want. And feel free to start the presentation as you wish. And certainly I will join you at the end.
Thank you so much, Dr. Pavel. Thank you for the introduction. The well-known introduction. Thank you so much. I'm happy to be with you today, and I would thank Global Summit for the idea of sharing knowledge all over the world between dentists and other physicians. It's a very nice idea. I would love to introduce myself. I'm Ahmed Hamdy. I'm assistant lecturer of periodontology and implantology at the British University in Egypt here, located in Cairo. I love perio world, actually, and I love reading and writing about it. So it's my mania, if I could call it. I'm working for 11 years now in my private practice. Also, I'm conducting some researches and courses in the field of implantology and periodontology. As you know from the title of my presentation, I will talk about custom healing abutments in the field of implant dentistry. I hope it will be a useful presentation to you. And again, I'm so happy to be with you today. If I could start, I can do it right now.
Please go ahead. It's a pleasure. I look forward to your presentation. Go ahead.
Okay, thank you. I will need your opinion after all.
Absolutely. You know, I mean, I'll throw one last thing in there. It's kind of ironic, but I love creating things. And over the last 10 years, I've created several products. And one of them is the VGO system, which is a dilated system called the variable geometry osteotomes. And why are they variable? Because I changed the taper of the traditional Summers concept. And the way I dilate the bone with them is unique in the sense that it's done more internally with less stress on the crest. But that's a whole discussion. But the reason I just throw it in is because it's so ironic that when I went to Dr. Sharif Radwan, he used the very dilators that I created that are manufactured in the US by Helmut Zeff in Germany on my implant. So I got actually
Yeah.
to experience an implant being placed in my own mouth with the system I created. So I very much encourage people to create and to share and to, we all can contribute a bit to bring dentistry that much closer to perfect, and
Yeah,
it's
yeah, of course.
that's why I love new presentations and such new experiences that we share from all over the world with different colleagues with global summits. But please go ahead, proceed.
Super, thank you so much. Okay, I will start to share my screen now. Okay, is it clear now? The full image of my slide?
Yeah, please proceed.
Okay. Okay, as we mentioned, we'll start talking about custom healing in immediate implant dentistry or in implant dentistry. I would try to globalize the concept today with my presentation. I will start with the hot topic. We are talking about the most recent topic about custom healing abutments around implants. Then I will try to give you an idea about how to generalize the concept of custom healing through implantology. As I told you, I'm from Egypt, the land of pyramids. Of course, a very ancient country. This is my work here. I'm working at the British University in Egypt, located in Jork City in Cairo. I'm doing my research this year with my colleagues there and in cooperation with Ain Shams University. But to start our topic fastly, as we know in implant dentistry nowadays, there's too much concern about aesthetics, not just the function of implants we place in our patients. Also, we need to make sure the natural appearance of our implants in the oral cavity is as well as natural teeth. So an aesthetic implant supported restoration emerges through surrounding tissue like natural tooth. We need a natural mucosa and natural bone crust. All items that will give you a natural appearance. Many techniques to condition the peri-implant tissues were used, like immediate provisional restoration, as we will see in cases later on during the presentation, or using a custom healing abutment, or doing a staged provisional techniques after the implant osseointegration. This whole idea of position of our implant is related actually to the implant placement position and the soft tissue thickness or biotype surrounding our implant. I would refer to such a very nice article by Gomez et al. In 2021, talking about the concept of emergence profile, the EPC, which I will show to you right now. It was published in JERD, the Journal of Aesthetic and Restorative Dentistry, talking about the aesthetic biological contour concept for implant restoration emergence profile. As we all know, that we have a critical contour and subcritical contour during our provisionalization to the peri-implant soft tissue. But it was the first time to study the different zones in this area of peri-implant tissue. So in this article, Dr. Gomez classified the zones into 3 zones. The first one is the E zone, or the aesthetic zone. The second one is the B, or biologic zone. And the third one is C, or crestal zone. Each one has a different level in the vertex of the peri-implant tissue. As we'll see, the EPC, the estatic zone, actually is the part where the circular epithelium lies, around 1 millimeter from the gingival margin. The biologic area or biologic boundary area, it's actually non-keratinized epithelium, and it takes from 1 to 2 millimeter beneath the first layer. And the third zone is the crestal zone, which is under the connective tissue attachment, and it's from 1 millimeter to 1.5 in length. Actually, every zone you should design separately from the other one to customize how the peri-implant tissue could heal. As we will see, we have a very large differences between the periodontal and the peri-implant soft tissue. We have a lot of lack of blood supply and immune cells, and actually a weaker attachment of soft tissue around implants than around teeth. Keeping that in mind, we have to do some sort of protection or more protection to the soft tissue around implants to prevent the consequences of inflammation or type of detachment of this kind of tissues from around the implants. As you see at the diagram, you will have here around the implants, we have some sort of parallel collagen fiber attachment. And around the periodontal tissue, we have an intertangled tissues that makes it more strong to protect the tooth. So whenever an inflammation process happens, you will have to break this weak attachment of collagen fibers, and a pocket or some sort of a peri-implant disease would go on. And this is also a diagram to show the intertangled pattern of collagen fibers around these, and the parallel orientation of collagen attachment around implants. This is under electron microscope. So regarding this whole area of talking about the peri-implant soft tissue and the weaker support, we need to protect it. So if we put an implant like this animation, and this is the zone we are talking about, and call it a biologic width, it's around from 1 to 2 millimeters. It may exceed to 4 millimeters in some subcrystal approaches. This biologic width regarding the area, which is just above the platform of our implants, it's called the crestal zone, according to Gomez et al. The crestal zone, if we put any kind of abutment here or healing abutment that got this divergent design from the platform switch, it will give you some pressure necrosis around this area. This pressure necrosis over the bone would lead to loss, would lead to resorption or faster resorption. And this is not what we need right now in 2022. We need to stabilize the crystal level around our implants. So that's why Gomez, in his article and study, he suggested doing this crystal zone with a straight contour, not with a diverged one as we have from our stock healing abutments. So after extraction of our implant, as you see, I need to fulfill all this area. I put an implant here, and I need to fulfill all this area with a custom healing abutment. It takes the same shape of my natural socket, same emergence profile of my natural tooth. So what I do, I just do like this. I'm putting my temporary abutment. I'm building a composite core to fill all the area of my natural socket appearance. The basic method of creating the emergence profile is by using a gingival former. And a gingival former, as you know, has different designs. Different designs you may find a straight design, you may find a diverge, a little bit diverge, but you will never have a custom shape for your normal socket or for your normal healing emergence profile you will need. You have to customize it to reach this kind of natural appearance. Like you see here, by using a normal gingival former, you will have these nice shapes. It's nice. You will do a keratinization around your implants and you have a very nice dimension, but it's not really the exact one you need for your natural teeth. When we try to put our crown, you will find a little plunging in the mucosa around implants, which represents that you have a little over contouring of your crowns over the gingiva. And this is not a mistake in crown fabrication. It's just you don't fabricate an ideal design for the gingival architecture before you put your crown. And that's why we need something more customized. Like this case, and a straightforward immediate implant case, and doing first stage or single stage implant with a healing abutment in place. This is 3 months after. You will find an emergent profile not ideally because the gingival former is not customized according to the natural appearance of the tooth. This is 3 months with well-organized and keratinized pre-gingival tissues, but with no actually the shape of our natural tooth. Actually, the case is followed by our crown, which is was well, and our patient was happy with the result, but we are looking for perfection, as we say. Okay, how can we reach a custom emergence profile? We have many techniques, as we talked earlier. The first one is a provisionalization, is to do a provisional crown. And the first step or the ideal step is to do it during your immediate implant placement, during the socket is opened. So this is the case, missing lateral incisor. Actually, in the X-ray, there was a remaining root inside the bone. So this is a virtual planning. What we will do, placing our implant and the virtual crown and the virtual space mesiodistal and buccolingual and apicocoronal. We started by removing or extraction of remaining root and drilling the normal drilling sequence of our implants. Then we put immediately a temporary abutment with provisional crown over it. We left it for some time. It was 2 months and a half. And you will find a very, very nice architecture of the gingival margin with a full recovery papilla, mesial and distal papilla, and gingival contour service, which is ideal for our future crown. This is more 2 weeks. You will find the gingiva is more mature, more pink in color, more fibrous in shape, and this is all a good signs to complete your work. This is a occlusal view. Look how nicely is the gingival architecture of the lateral incisor. And if you can compare in mind between this image and the images of the result of the stock healing abutment, you will know the difference. You will know how this is more acceptable and more preferable to complete your prosthetic work with it. This is the final result, the crown in place. Look how nicely it's gingival, no plunging, everything is fine and everything is with its normal color. You will find also a convexity around the cervical portion of the crown, which my making natural. This is a frontal image. And this is the lateral view. I would prefer always to do a black and white photography for my crown to see the micro texture that my lab doing. Is he doing a good job, or just miss some details? In comparison, this is another case with a missing lateral using just the stock healing abutment come with the system. Look how deficient is the emergent profile. This is not an ideal emergent profile for my natural teeth. I need this shape. I need this shape just to do my future lateral incisor, but only a cylinder form in my peri-implant soft tissue is not sufficient to start doing my prosthetics. Also, when I'm doing this kind of prosthetics over the shape of the cylinder form coming from the healing abutment, the stock healing abutment, I'm not supporting the papilla right and left. As you see the before picture during the custom healing one, during time, the provisional crown was doing some sort of pressure around the right papilla and the left papilla that would come to overgrowth. It would give them some potential to grow and fill all the triangle between the adjacent teeth. But using the stock abutment, it will give you a deficient lock of your papilla, and we need time to see if your future crown, your final crown, would give the same pressure during time and stimulating the growth of papilla or not. And this is a kind of trial and error. If you need to do a nice shape or a nice papilla, you need to give it a try during the provisionals, because if the design of your provisional is not very good, you can add on it or you can subtract from it. It's after all a provisional one. But if you doing a final crown for this purpose, it will be not an ideal solution to design or engineer your soft tissue, and actually not an economic one as well. This is the frontal view. As I said to you, you will find a deficient papillary heights. But after all, our patient was happy with the crown in place, with the lateral view, the crown in place, and we will need to wait to see how the papilla will grow and how it will block all the black triangle between the crown and the adjacent teeth. Okay, what is your second option to do a custom healing abutment? Second option actually is to do with a freehand building of a resin material over your temporary abutment. You need to buy a temporary abutment from your company provider, and you will build with plastic instrument and resin material or composite. You will have to build it freehand and try it in the socket of your immediate implant. Then if you need to modify it by adding or removing using rotary instruments, after that you will need to finish it and polish it and leave it as a very, very smooth and polished surface to make the soft tissue good during healing, because any rough surface would give a non-uniform soft tissue texture, which is not good for your healing potential and healing sequence of your peri-implant mucosa. So this is the first way, by using a freehand building of resin material. Okay, what is the second way? The second way is by using the anatomic profile generator or a custom-made healing abutments. It's like a template with certain shapes. You would just need to inject your flowable resin inside and cure it with your light cure device, and you will get the nice shape with a smooth surface coming out from this template. We have different designs and different shapes in the dental industry. We have this one, have the other one with multiple shapes, or we call it wells. We have multiple wells with different shapes according to the shape of your normal tooth. And we have a very clever idea coming out from VBI. It's called a cervical mold. A cervical mold is like a combination of all I was talking about. It's a kind of this tool. This tool is divided into two compartments. And the first compartment is a silicon template, which replicating the anatomic profile generator that I was talking about. It contains like 17 wells with different shapes. And the second compartment is called the VBI prosthetic compartment, which contains 36 connection inserts, like you see at the black cylinder. This 36 all different or all most common connection types of the implant systems. You can just get your temporary abutment and make it through this connection and secure it, and put your silicone template over it and inject your flowable resin material. So you don't need to buy certain analogs or certain accessories from your system. This tool gives you the potential to doing a lot of systems together in one tool. You don't have to buy an analog from your system, and when you trying to put implants with another system, you need to go and buy another accessory from this one. This tool gives you all what you need in one tool, which is a very, very clever idea, with also the potential to swivel this silicon index over the underlying connections. So it's too flexible, so flexible to do your custom healing with easy steps. As you see here in this slide, this is the image of doing the custom healing abutment. You just need to get your temporary abutment from your system provider and secure it over the connection, inject the flowable composite around it, cure with like your device, and you can extract it and put it inside the patient mouth. Of course, I would recommend always, let's get back to the slide. I would recommend always to finish and polish this kind of healing abutments to reach, as I told you, a homogeneous and uniform healing pattern of the peri-implant mucosa. Okay, it comes with a system, certain guides to help you place your implants according to what you're planning for and on what you plan to do a custom healing. It gives you a certain position which you could transfer to your cervical mold and start making your custom healing upon it. And as you see here in the slides, this is the full case from the cervical website, using the guide and doing the custom healing. And this is the result after removing the custom healing abutment. A very nice gingival architecture ready to go for prosthetics. And of course, according to your different gingival placement criteria, you will need to adjust this kind of healing abutment. One tip here I should tell you about. In this kind of tools like anatomic profile generator or the silicone templates I showed you earlier, you will find some sort of difficulty in doing an emergent profile during injection of your flowable composite. This is why, let me tell you something. And when you're starting working with this kind of templates, you will need to have an implant analog and a temporary abutment over it. Okay, how could you standardize your position or your vertical level inside the template? You will never know. actually you'll start to put it and inject around the finish line of your abutment, but you never know where is this finish line in your patient mouth, because you may go for a bone level implant, or you may go for a subcrystal implant placement. It may be 1 millimeter subcrystal, 2 millimeter, or 3 millimeter subcrystal. So how can you manage to transform this relation to the anatomic profile generator or to silicon index? You will never do it. You can do it accurately. But actually, if you go and search for the cervical, you will find a very clever also idea that this kind of connections found in the bottom ring of the cervical is divided according to vertical depths. It's divided according to if you put it 0 or bone level, or if you put it 1 millimeter subcrystal, or 2 millimeter, or even 3 millimeter subcrystal. Of course, if you put it more like 4 millimeters or something in certain cases, or with periodontal defect patients, you can't even do it accurately with the cervical. But let us say that by using cervical, you will have like 90% of your cases with accurately put in mind. But with the ready-made silicon indices like the anatomic profile generator, you can do your custom resin abutment with accurate regarding the depth of placement of your implant. This is the kind of difficulty you will face when using this kind of tools. Okay. Backing into the idea of emergence profile zones, this is the EPC, which we're talking about. The E, the ecstatic, the B boundary, and C, the crystal, which is the nearest zone to the platform of our implants. What to do exactly in steps? How can we do what I say to make a custom healing abutment? Let's see a pre-operative photo of a case. A badly broken down upper first molar, which need to be extracted and going toward implant placement. This is immediately step one. Immediately after extraction, we have a very, very nice interradicular bone, which could in-house our implant so easily. This is adenosine Smith and Turnau classification. This is class 1, which indicating putting our implants inside, completely inside the interradicular bone. And this is step 2, osteotomy preparation inside the interradicular bone. Implant insertion in place. What we need to do now, we need to save or taking the same shape of my socket. This is the same shape of my tooth. I needed to transform until I make a prosthetic crown for my implant with the same gingival architecture as upper first molar. What I need to do, I need to put a temporary abutment with a composite material to fabricating a custom healing abutment. Okay, this is a very old case of mine. It's like 4 years ago. And this kind of maneuver, I would never recommend anyone to do it anymore. Here, I just inject the flowable composite material around the stock healing abutment to make it more large and more customized to my normal socket. This is not favorably to be done because it's very difficult to remove. When you got to remove it after 3 months, it's very difficult to remove and very time consuming. If you need to do this job, you will have to get a temporary abutment, which is indicated for this kind of things to build up temporary material. Okay, and this, of course, this case was done by dual zone grafting, with doing a bone graft for the sockets and a bone graft also for the peri implant, because to support the soft tissue around my implant. Okay, this is after some months, like 3 months. This is the shape of my molar with the same shape and same emergence profile from my platform till the mucosa. As you see here, if you give a look at the labial part of the emergence profile, you will feel like it's not well supported. And this is true, actually, because this is the place, or this is the aesthetic zone, which will be supported by our final crown. When you give a crown here, you will have to do the aesthetic zone as convex as possible to support this margin of the gingiva, which will give you the normal convexity of a normal tooth later on. But when you remove your prosthetic, you will find it more delicate, or going through the socket or the gingival shape of your implant. As also, I would like to show you the idea of the custom abutment, which is the pre-milled abutment. The pre-milled abutment is a very, very, very unique and good method of fabricating your final crown, especially when you are dealing with custom healing emergent profile. After doing this nice shape, you will need to do a nice final crown to support your gingival architecture. So you will need a pre-milled abutment, which will give you the potential to design and prepare your abutment as you prepare your tooth. So it'll give you a broader horizon, or a broader finish line, broader base to put your crown over it, and give you the idea of the horizontal biologic width. The idea of horizontal biologic width is by placing the margin, the crown margin, too much far away from the crystal part of our implant, which could lead to good or better mucosal seal around this zone. Subsequently, would protect more implant from inflammatory reaction and exudates. How to transfer this relation after you do your job and do your custom healing abutment in your oral cavity for your patient, how to transfer this shape to your lab. This is actually the idea we will talk about right now. Like this case, when you see custom healing is inside my patient now, and after removing this one or this custom healing abutment, you will need 3 things to transfer this relation or this shape to the patient, to the lab, sorry. First thing, you will need your custom healing abutment, so you will need to remove it from your patient mouth. Second thing, you will see an implant analog. And the third thing is transfer coping tool. And you can use a closed transfer or an open transfer, but I prefer always to do an open impression technique. So I'm using an open transfer coping. The first thing you need to do is to put or secure your custom healing abutment inside the implant analog outside the patient mouth. Then you will get a putty impression material, mix it with the activator, and try to put the whole component of the custom and the implant analog inside this part of putty, and wait until it's activated and be rigid. After setting of the impression material, you can just use your screwdriver to remove the custom healing from the analog, and you will find this shape. You will find the analog inserted into the set impression material, and the whole shape of the custom healing is imprinted or recorded inside the rubber putty material. Third thing to do is to secure your transfer coping inside the implant analog and start to inject a flowable composite around the temporary, the transfer coping, and cure with the light cure device, and just take away your transfer coping, it will give you a custom-made transfer coping for your patient. You will just have to get it back to the patient mouse and take your impression with the normal impression technique, and you will find this shape in your impression. This is an impression with the implant analog back into it, and you will see how the composite taking the shape of the emergence profile you already did in your patient mouse. Later on, when you pour your cast and doing the gingival replica, you will get over the cast the same shape as you do in your patient. And starting by fabricating final crown, this is the final result of emergence profile in the patient mouse. And this is the crown in place. This is the closure lock. Look how the gingival architecture and color, how healthy and normal appearance. Okay, this was a talk about the special or specified topic of doing a custom healing emergence profile around our implants. But I would prefer to give you an idea how to generalize the concept of doing a custom healing in tissues, which was my last research 2 years ago. I was researching about how to customize the idea of healing of my flap. When I'm doing an implant surgery, I'm elevating a flap and putting this flap back into position. Okay, what if I need or I have a defect in the width of keratinization in this side of my implant? I'm using, let's see a case, and I will start to discuss some of my idea. This is a preoperative view of a case missing lower 6 or lower first molar. I don't have enough attached zone or a keratinized because around the site, so I have to develop something to increase it. Here I'm measuring the width of attached zone before the surgery. Actually, I could say it's 1 millimeter or less because a large part of this distance is over the crust. This is the zone which I will put my scalp to cut and elevate my flap. Okay, first thing first is by using, doing this surgery by using something called the papillary sparing incision to prevent the healing consequences over the papillae, will give you a better potential to grow and multiply. Doing my osteotomy and putting my implant, straightforward implant placement with no problem. This implant in place, doing a combined full partial thickness flap, and this is this case was done on the first stage by using the implant placement, and I just secured the healing abutment at the same day. Then I'm doing a type of apically positioned flap. I'm trying to move my flap from the lingual part to the buccal part to increase the zone of keratinization in the labial or the buccal part of my implant. The problem here is that when I'm doing an apical position flap, every time you are using suture to hold this flap in place, you will lose some sort of your flap over in a coronal direction because of the tension of the suture line. When you're doing a suture line, it will give you some tension. It will pull your flap against the gingival former, which will make you lose some of keratinization in a kind of gingival margin or free gingival margin. As I told you, our problem is that we need a zone of attached gingiva. The attached gingiva is the kind of gingiva that is superficially covers the underlying bone. We need this zone, this firmly adherent zone over the bone. We don't need a free gingival margin. You don't need to give your keratinization to the free gingiva, which is not firmly adherent to your tooth or your implant, and it will be the weaker protection zone here. So to develop this kind of custom healing, how to customize the healing, the future healing of your flap, use here a kind of ready-made plastic stent, which will I will give you its shape here. This shape, ready-made plastic stent with certain design. It's secured over your healing abutment, so you need to do a single stage implant placement protocol, which is considered as safe as a two-stage. It's a non-submerged technique by putting your implant and securing the gingival formula at the same day. Then you will need to put this kind of stent to making the flap unmovable. Actually, you don't need to put suture at all by using this stent. It will give a very nice and stable flap for around 10 days. Then you will need to put it away. This is 3 months after. You will see how the adherent attached zone increased with a good amount. This is the time with crown cementation. Here I used a combined crown, which is a hybrid one, screw cemented crown. At the same time, as you see, you will see a large black triangle, but by taking in our considerations the Ternau rule, the 5mm rule of Ternau, you will see after time, this is 6 months follow-up, the papilla started to grow and fell our black triangle. Leaving it more time, up to 9 months, you will see a very, very nice view of papilla fulfilling all the triangle, and the maturation of soft tissue, the width of attached zone, how fibrous and pink as it is, and it would give us a very, very nice shape. Actually, this was my study I published in 2021. Effect are using a plastic stent with apically positioned flap in the peri-implant soft tissue augmentation. It was an RCT. You will find all the data and the shape of the stent, how to use it over the implant in a first or a second, a single stage protocol for implant placement. And finally, I would be so happy if you could subscribe to my website. You will find an education material, some cases, and also a notification for the new events and courses I provide. Actually, I provide here in Egypt an implantologist masterclass in the basic and advanced modules, talking about everything. You will find our feedbacks and our image gallery. Also, during the website, you will find everything connected through Instagram page or Facebook page. Also, my personal email for any inquiries or questions you need to know. The last thing you will find is a Perio Hub, which is my blog site for articles and topics talking about implantology and periodontology. Thank you so much. I hope it was a useful presentation for you, and thank you for listening.
Well, Dr. Hamdy, that was a really wonderful presentation, and it was full of innovative ways of doing things. And what I personally loved is the fact that what you explained is to mimic nature. And as we know, teeth are not, these perfect circles or these perfect triangles. They have emergence profiles that vary, and we have to try to mimic exactly what nature did. And I really salute you on this wonderful presentation. It was truly inspiring. But I think that some of us as dentists, I'm sure this applies to other professions as well, but I can speak for dentistry. I think sometimes we get so locked into doing things the way that we've done it for 20 years or 10 years, and we're not receptive to change, or at least to modify what we're doing. And I speak for myself. But for me, it takes time sometimes to just do something with where technology is today. And I just think I highly encourage the younger colleagues out there to look around you, explore. Don't just believe what everybody tells you. You have to make sure that the speaker or the person who's introducing you to something new is not just doing it because they're being paid by a company. He's doing it because he believes in the product and the concept. So get other opinions, talk to your colleagues about how things work. But certainly there's so much innovation and so much new technology. The dentistry is really changing in a way that is just going to keep exponentially increasing. So thank you so much, Dr. Ahmed. And if we have any questions that the audience has for you, let's take a look. And
of course.
Thank you.
Thank you so much. Thank you.
Do we have any questions, anyone? Mr. Rasul, anyone like to talk to Dr. Hamdy and perhaps ask a question or two? Okay, I guess that'll be it. Again, to our audience, thank you so much. With Global Summits, strive to bring you doctors from across the world. I think we're up to about 150 countries, if not higher, of speakers that we bring to the table who share knowledge, wisdom, how they do things. They share not only how they do things, but also what the literature does. And, so we're very proud of what we do. And most importantly, we're proud of uniting healthcare and the profession of dentistry and chiropractics and pharmacy, just everyone together in healthcare. So that's our pride and joy. This is again Pavel Krastev, DDS, and I thank you for joining us today. And we certainly hope that you've enjoyed the show. Thank you.